So one of the things people always want to know is, how do I know if my dog is in pain? And aside from, like acute lameness that we're very familiar with, limping, that sort of thing, there are other signs that we can look for that are going to indicate pain responses in animals. He wants to walk right next to me, so he's going to make this difficult. This guy is Sphinx. He's 14 years old. And by looking at him, he's not limping as he's moving, but he's clearly showing me signs of pain. Bonus points to anybody who can... Yeah, I'm gonna let go of the leash because he's good. Showing me very obvious signs of pain here. The first one that I'm gonna look at is his head position. While he could be sniffing, he's holding his head quite low. When they're holding their heads this low, it often means, he's going to use the bathroom, often means that they're trying to offload weight from the rear end to the front end. If they're walking with their head really high, that can be a sign that there's pain in the front end. So with his head down low like that, Sphinx, he's going to go home apparently. With his head down low like that, we're going to look at there being a pain response in the back, in his rear end. So there's another clue about how he's feeling in the rear end. And there's a leash there, but see how he's kind of moving his legs in a rotary sort of way? They're kind of going wide and then they're coming in. That can be a sign of issues in the hip. And then notice how his back is kind of arched. That can also be a sign of pain in the back. Okay, he says I'm done. We'll talk about more when I get him inside for palpation. Okay, we're back inside with Sphinx. He's 14 years old, as I tried to say outside. He has back pain and hind end indicators for pain, as we saw watching his movement. He kind of moved with that low head position and maybe a little bit of an arched back, and he had some rotation of the rear limbs. So we are going to kind of do an examination over his whole body today to see if we can kind of find where some of this stuff is originating at. But first, I want to kind of show you how he's chosen to lay here, because he's giving us some clues as to how he's feeling. Okay, when we look at him from the front, he's kind of resting a back hip here. See how he's got one kind of moved out from the other? When they're laying like this, they should be both tight up against the body. And then you can see here in the front, he's got one elbow pulled in because he's kind of protecting it, and putting weight on the other side to kind of stabilize himself. So when they're sitting like this, they should be pretty straight and pulled in tight together. And the fact that he's kind of sitting a little crooked is a good indicator that we've got some pain somewhere within the body. And it's our responsibility to see if we can figure out where that's originating and give him some relief. So with that, we're going to go through an exam with Sphinx and do some palpation to see if we can kind of find the origin of some of this pain that he's experiencing. Older animals tend to prefer to lay down, and that's okay, but for the purposes of this demonstration, it's easier for me to show you with him standing. So the first check we're going to do is checking with his neck. He doesn't see very well, but he can still smell. So I'm using a treat to try and lure him up. You can see he's very hesitant to go up in the position. A normal, when a dog has full range of motion, they should be able to point their nose straight up at the ceiling. I'm going to just kind of guide him, and that's about as far as he really wants to do. I prefer active stretching using the treat. If you're going to do passive, then just make sure that you're there to be a guide for the dog. You're not actually putting pressure. Okay. The next check, we're gonna go from side to side. So I'm going to get him to lure, hopefully, to his shoulder. Okay, he's hesitant to go that way. Can we get him to go the other way? He's like, I need the treat bank first. Okay. Let's see, we're gonna get your nose to smell. Might need a couple more for you to be able to smell, huh? Old guy needs more motivation. Okay. Yeah, so he is pretty hesitant to go. And to double check, I'm just going to lightly guide him so he knows what I'm asking him to do, and make sure it's not a question of I'm not understanding what you're asking of me and he's actually not feeling good that way. And he can go about this far. A dog with full range of motion should be able to touch their nose to their shoulder blade. Okay, I'm gonna, as you can see, I'm just facilitating this. I'm not putting any pressure. I'm like putting just a little bit of guide into it, and he's doing all of the work. Okay, and he has about the same range going the other way as well. I'm gonna give him his treats here, so we keep the stress bank full. Huh? Can we stand up? Can we stand up? He doesn't hear very well either. He's a good old boy. Okay. There we go. Can we stand up? Can we stand up? There we go. Good boy. Make sure his feet are under him so he's nice and stable. Next one I'm gonna try is down to the floor. And if I can get him to, we wanna go between the legs. Oh, that's a good boy. So what this does is it's going to stretch all the way through the back. You can see that he did that pretty well, although he was understacked, so he was already kind of in that crouched position. Let's see if I can get him. Come on. He's not so sure. Okay. He's doing pretty good though, so I'm not going to push it. We still have, a lot of weight up in the front for him. Okay. All right. So once we've moved past the neck, we're gonna go to the front limbs. This would be your wrist, elbow, and shoulder. So you're going to just support their weight, and you're going to gently lift up their foot. No pain response in the foot. He's pretty good about that. Then we're going to take the wrist, and we're going to try and put it up there. So you can see I have a gap here. The wrist should be able to fold back all the way against the forearm. So if you can see, my thumb kind of fits in that joint there. So he's got limited range of motion in this wrist, and it could be causing some pain or discomfort in the front end. Okay. Now we're gonna check the elbow. I don't feel any clicking. Shoulder, he's pretty loose. Now we're gonna try and extend. He's a little hesitant here. Okay, I did feel some clicking in the elbow when I did extend. We don't want to extend too far. We're looking at his scapula here, and the angle of that scapula, you don't want to extend past that. Okay, so he doesn't want to do that very much, so I'm not going to make him. So we want to note that he was tight in this wrist, and he had clicking in his elbow. Okay. Then we're gonna go to the other side because we always want to check both sides to look for some symmetry. He's maybe just a little bit tight on this wrist, but not as bad as the other side. Elbow feels nice and loose, along with the shoulder. Sorry, buddy, I wasn't supporting your weight very well, was I? Okay. So I'm gonna stand up to get this side for him so I can stabilize him a bit. Okay, and then we're going to extend. No clicking in this elbow. Tricep feels pretty good. No real pulling back or reluctance there. So he's feeling really good. Okay. Now we're gonna move towards the back. This is usually another indication if there's pain. Most animals will stand nicely for an exam, but if something is feeling off or off-putting, they might need to sit down. So that's also another indication for you. When we're checking along the spine, we can just make a C with our fingers and run it along. We're looking for any twitching, flinching, pulling up of the body. He doesn't have any of that. That could indicate any, sort of pain along those issues wherever you would see that twitching. Something to note with him is he does have a spot here that he's been chewing the hair off, so it could be a place of irritation for him. To check the rear end, we're going to just gently lift up on the rear leg, supporting his body. Okay, he is hesitant and tight to do this, especially in the hock. Okay. Knee feels pretty good, but hip is tight. Okay, and then we're gonna gently set him back down. Then we're gonna check the other side because we always want to double check symmetry. Okay, this hock is a little bit looser. Knee feels pretty good. Hip doesn't feel too bad. And we can extend. He wasn't hesitant to do that. It's pretty good range. This way too. We run out of room because there's the couch, but he's pretty good about it. I'm just gonna kind of feel the muscles. Okay, he's an old guy. He doesn't have a whole lot of muscling at this point in the rear end. Lots of atrophy, which can be a sign of pain as well. He does have a small fatty lump here, and you can see that when I'm putting some pressure on it, he is irritated by that. You can tell by him licking and kind of looking around. So I'm not going to mess with it too much, but that's something if you find something like that on your dog and you can see that they're a little bit irritated by it and it hasn't been checked out by a veterinarian yet, that is something that you would want to get checked out. Okay, and then he's acting really shy right now, but with the male dogs, we can have other indications for pain, and that's by looking at their sheath. And for him, his penis doesn't go all the way back into his sheath all the time, and that can be a sign of pain and inflammation in the rear end as well. So that's something to pay attention to with the male dogs. Overall, he's not too terrible. He's tight in the wrists a bit, and maybe in one of his elbows. His hip is a little tight when we're doing flexion, and he's got a couple of spots that maybe need some attention that could be causing some pain in him to shift there. He's definitely got pain in the neck. So in this instance, we're not finding a whole lot in the rear end, So all of his pain in that lower neck position could be because he has, you know, like something going on in the neck. Especially because he's not wanting to lift all the way up. He's limited both sides laterally. So it could be that his low neck has something to do with the upper spine at that point, because, you know, we've kind of eliminated most things in the back other than, you know, having a little bit of a tight hip. But we're also, you know, seeing wrist and elbow, so he's got a lot of pressure going on into his front end. So for Sphinx, you know, for body work, we would work at looking at his neck and his front end to see if we could start getting some weight moved back into the rear for him, and work on building some muscle tone to help support his joints. So, what do you think, Sphinx? Sound good, buddy? He's like, I think so. I think I got some treats left in here. I can give you a snack here. Hey, look it. Smell. Yeah, good boy. His nose still works. All right, so that's Sphinx.